Radiation protection in healthcare. Healthcare staff may be exposed to ionizing radiation from radiation-generating devices used in diagnostic and therapeutic procedures. Examples of devices include portable and fixed X-ray machines, fluoroscopy units, and linear accelerators. Staff may also be exposed to radioactive materials, such as radionuclides used in nuclear medicine, which are regulated by the U.S. Nuclear Regulatory Commission, NRC, or an NRC agreement state. Radiation doses received when workers are near an operating radiation-generating device or a radioactive source. The dose received depends on the type of radiation, the amount of radiation generated, the duration of exposure, the distance from the source of radiation, and the amount and type of shielding in place. Radiology department staff members may be repeatedly exposed to low levels of ionizing radiation over the course of their careers. Adverse health effects, such as cancer, may occur years following such exposure. The probability of an adverse health effect occurring is proportional to the radiation dose received. Studies of atomic bomb survivors have shown significant associations between cancer and radiation dose levels of about 10 rems or greater, with the cancer risk increasing as the radiation dose increases. For low-level radiation exposure, i.e., whole-body doses less than about 10 rems, statistical limitations in studies have made cancer risk assessment more difficult. In 2006, the National Research Council's Committee to Assess Health Risks from Exposure to Low Levels of Ionizing Radiation reviewed the available data and concluded that the cancer risk would continue linearly at low doses. This finding means that there is likely no safe exposure level, i.e., threshold, and that even low radiation doses have the potential to cause a small increase in cancer risk. National Research Council 2006. In addition to cancer, cataracts, i.e., detectable lens opacities, are another radiation-induced health effect that could occur in radiology staff. International Commission on Radiological Protection 2011. For more detailed information on health effects from radiation exposure, see OSHA's Ionizing Radiation Safety and Health Topics page. For OSHA requirements on ionizing radiation, for example, exposure limits and monitoring, posting, and record-keeping requirements, see OSHA's Ionizing Radiation Standard, 29 CFR 1910.1096. In certain circumstances, OSHA's standard requires employers to provide personal dosimeters for the long-term monitoring of a worker's radiation dose. Dosimeters include thermoluminescent finger dosimeters, TLDs, optically stimulated luminescence body, OSL, dosimeters, or film badges. These passive dosimeters for personal exposure monitoring can be worn whenever working with radiation-generating devices, radioactive materials, or radioactive patients. Depending on the work situation, wear a body dosimeter at collar level, chest level or waist level. Wear finger ring dosimeters on the hand which is closest to the radiation source. Personnel who work in high-dose fluoroscopy settings may be asked to wear 2 dosimeters, one outside and one inside the lead apron. For OSHA requirements on personnel monitoring, see OSHA's Ionizing Radiation Standard, 29 CFR 1910.1096. Other radiation safety practices. Provide radiation safety training to all workers who operate or are exposed to radiation-generating equipment, radiation sources, or radioactive materials. Keep radiation exposures as low as reasonably achievable, ALARA, and certainly below regulatory limits. The 3 basic concepts of radiation protection are: 1. Minimize the time of exposure, 2. Maximize the distance from the source of radiation, and 3. Use shielding. Applying these concepts will help to keep radiation exposures ALARA. Some examples of radiation protective practices include: using the shortest practical irradiation times, equipping X-ray rooms with a barrier wall with a lead-plated window for the technician to step behind before taking an X-ray, using radiation-absorbing shields such as ceiling suspended lead shields and table suspended drapes as barriers to protect against X-ray exposure when procedures are in close proximity to the patient. providing and ensuring employees use personal protective equipment, PPE, lined with lead or lead equivalent materials, for example, products made from dense elements or alloys of PB, SB, BI, including lead or lead equivalent aprons, thyroid collars, leaded eyewear with protective side shields, and leaded gloves for use by workers in the X-ray field. Ensure that workers do not place their hands in the primary X-ray beam. Providing and ensuring employees use properly fitted aprons to reduce ergonomic hazards and provide optimal radiation protection. Ensuring that procedures, like those that use remote fluoroscopy, are run using controls in an adjacent room, to the extent feasible. Giving a specific person the responsibility for ensuring proper maintenance of portable X-ray machines. Preventive and corrective maintenance programs for X-ray machines are detailed in 21 CFR Part 1000, Radiological Health, U.S. Food and Drug Administration. Thank you for watching.